Thank you all very much for being here. And I want to thank Katie Smith-Sloan, who's the CEO of Leading Age, which has some 5,500 nursing homes all over the country, for being with us. I want to thank Dick Cato, who is with the A.G. Rhodes Nursing Homes in Atlanta. And I want to thank Heather Turbine Pollard, who is with the Center Circle Adult Day Services in Richmond, Virginia. Thank them all for the enormously important work they do for our seniors, and thank them for being with us today, and thank all of you for being here. It is no secret, I think, to anyone that the American healthcare system is broken, it is dysfunctional, and it is cruel. Today we have 85 million Americans in the wealthiest country on earth who are uninsured or underinsured. 1 out of 4 Americans cannot afford to fill the prescriptions that their doctors prescribe. Our life expectancy is significantly lower than other wealthy nations. Some 60,000 Americans die each year because they can't afford to get to a doctor on time. And in fact, we don't have enough doctors, nurses, dentists, and other healthcare professionals. Meanwhile, because of the greed of the insurance companies and the drug companies, we are spending far, far more per person on healthcare than the people of any other country. We are now over $14,000 for every man, woman, and child, which is an insane number and totally unsustainable. So what we have is a crisis in healthcare, and Trump's big, horrific bill will make that crisis much worse. It will throw 15 million Americans off of the health care they presently have. So instead of providing health care to all people, throwing 15 million people off of health care, it will raise insurance premiums for millions of people all over the country, already paying sky-high prices. It could well cause the closure of many rural hospitals and community health centers all across our country, all of whom are significantly dependent on Medicaid funding. It will also, and the point of our discussion today, it will also have a major impact on nursing homes in this country. And that is an issue that has not gotten the kind of attention that it needs, and that's why we are holding this event today. According to a study commissioned by the Department of Health and Human Services, 70% of seniors in an aging country, we are an aging country, will need some kind of long-term care during their lifetimes. This can include assistance with activities of daily life like eating, bathing, and dressing. In some cases, family members can provide this type of care, but it requires from that family member enormous time, effort, and skill. And when you are dealing with horrific illnesses like dementia or Alzheimer's, it is also terrible stress on that family member. And that is why families throughout the country seek our support through home health care providers, through senior centers, or nursing homes. And let's be clear, even before the implementation of Trump's horrendous bill, nursing homes and long-term health care providers were already struggling. All right, so it's not like we had a great situation. We have a very bad situation, which is only going to be made worse.